Internet. Today we're going to be talking about erotomania, which is also called syndrome de Clérambault in French, or Clérambault syndrome. In the DSM it doesn't quite exist, if not delusional disorders in that category. So why I wanted to talk about it is because I think it's a very, very valuable diagnosis and clinical category to know, as it's very rare. I have to admit that it's like 0.03 to 0.05% of the population, so it's not enormous at all, but it has massive impacts for the person that has it, of course, but also for the family and also for the person that is the victim of the fixation of the erotomaniac. So I'm going to now define what is erotomania. So erotomania is the delusional conviction that someone else loves you. So I have to make this very clear, even though the person in the exchange does not, how can I say, overtly lose touch with reality, the syndrome still implies that. It's still a loss of reality, but it's a loss of reality in a very specific context of love, of a love that's delusional about a person that's often, very often in erotomania. It's someone that's highly positioned socially, that has something very valuable. Very, very, very often it can be a doctor, it can be a rock star, someone that has a high social position often. And that's going to be the start of the fixation. So in this syndrome, everything that I'm gonna say, like the pseudo-lover, everything the pseudo-lover does is interpreted by the erotomaniac as a sign of love towards them. And when I mean everything, I do mean everything goes. For example, if the pseudo-lover just like smiles to the person, or just cracks a joke, or just says hi, all of these things are going to be interpreted in the light of love. It's not going to be anything that's going to be contradictory with that. Every sign is going to be reframed, shaped in the interpretation of the erotomaniac, and in a way engulfed in the delusion. So what makes it very complicated to see is that sometimes, because those people don't overtly lose touch with reality, meaning that other sectors of their life are completely fine, they might be completely okay in all other sectors. Like if you talk about them about their job, they might be completely fine. If you talk about other stuff like hobbies, everything's going to be okay. But in that moment, the person, in the question of love is what's going to trigger something that you're going to see is detached from reality. As for example, let's say an erotomaniac obsesses about a rock star, you're going to see that things are going to start to begin to crackle in terms of reality and reality testing. For example, the person might say, oh, well, he loves me so much. And you may ask, how do you know? And the person's going to say, oh, well, he waved his hand at me. And you're like, but didn't he do that to a whole crowd? No, but it was me specifically, right? And often when you push back or when you try and make the person criticize it, it is not possible. The person cannot criticize their interpretation of the phenomena. The erotomaniac is so engulfed in it that there is no criticism. And if you do, they'll start criticizing you, saying that you don't understand them, that you're a terrible clinician, that you just don't get it. Also, what I have to say is that when you're working with people who have erotomania, you have to be very careful as a clinician, as erotomania can quite easily trigger within transference relationship, the transference and the counter-transference, meaning that the erotomaniac can absolutely fall in love with the therapist in the same way that they fall in love with other people. And when I say that, I'm kind of like taking shortcuts, because they don't feel like that. It's not them that's falling in love. They feel that the other person is loving them, but because they're projecting their own sentiment of love into the other, they feel that it's the other that loves them, but that they're not quite telling about it, or they're not being overt about it. And that's where it becomes very tricky, is that fundamentally that moment where they become convinced is untouchable, it's unbreakable, it is not criticizable nor by them nor by the clinician, meaning that it becomes a sort of status quo in which nothing's going to really move, like a sort of block. So for the Clérambault, there is 3 phases that are constitutive of erotomania. The first phase, which is arguably the longest, is the hopeful phase. It's a phase in which the person is going to interpret everything, as I just said, in the lens of love, that the other person loves them, that they are somewhat connected, as that all those gestures, those pseudo moments of partnership are interpreted. Everything is interpreted in the light of a secret love. But that person is going to hope that the pseudo lover is going to confess their love, meaning that there is a high intensity. It's as if the person was obsessing. Of course, the Clérambault never talked about this because he wrote in the 40s. But, and what you have to understand is that erotomania nowadays would be people fixating on, for example, rock stars, famous people, content creators, influencers, and so on and so forth, and doing the research at maximum. Like, I mean, such research that even a doctor would not do as much research on a topic than they do for their object of love, so to speak. So in that phase, they do a lot of research on the topic. They also can be very stalky with the people they obsess about. They can follow them. Because remember, in their reality, they are convinced the other person loves them. So in a way, they're not doing anything wrong by doing that. So they also explain away the fact that the person has not confessed their love. Because when you ask them why hasn't he or they confessed their love, often the erotomaniac answers it through a whole set of elaborate logic that's completely flawed, but seems logic to them. For example, they might say, well, he didn't come out to me because he has a wife, or he didn't come out to me because, you know, he's too busy, he'll get back to me, or he didn't come out because, like, I saw him, he didn't take my number, or he let it go, or I'm sure he lost it, he can be forgetful, I read that on the internet. And you see how everything gets explained away, and everything is interpreted in the light of the delusion. Nothing is random in this syndrome. Everything has meaning, but it's a delusional, detached from reality meaning. Now, so that's the first phase, it's the hopeful phase. The second phase is the phase of spite. So in that moment, the person starts to realize that the love is not going to be confessed, not as they wanted to. So they're going to start becoming depressed, self-isolating. So you might think that the person is grieving what is happening, but they don't. They still carry the hope in them. It's just that hope has, in a way, become stale and even a bit rotten within their minds. And that is going to lead them to have moments of depression. But what you have to understand, and it's very important, is that the delusion does not subside necessarily at that phase. And they're just going to become bitter about the whole situation. Meaning that they're going to say things like, why doesn't he confess? He had so much time. He had so many opportunities. He's not doing this. He's not doing that. And they're going to start building resentment. And the third and final phase, which in French is called rancune, which I'm going to translate by rancor, is the phase where they might become violent and dangerous. It's a phase in which fundamentally they will not back down on the fact of having the love of the other confessed to them. So often in these phases they might physically assault their pseudo lover or the wife or husband of the pseudo lover, thinking, oh, well, if I get rid of the person that's preventing him from confessing his love, then we can be together. And this can result in acts of violence, even murder. So it's rare, right? I don't want you to get the idea that these three phases, you get to the third phase and the person is automatically going to kill someone else, right? That's not true. But it's the most violent phase. It's the phase in which like there's a lot of acting out. To the most extreme being murder, but it's not the only one. Like, there can be many sins. It can be fundamentally phoning up the wife, insulted the wife. It can be like really, but it's a phase of acting out. So how does the treatment of these people go? Well, often it is advised to do psychotherapy, but the psychotherapy has to be done by someone that's very informed about that syndrome. As I stated earlier, there is a true risk that pseudo lover might be transferred onto the therapist. If it's a case, the work becomes virtually impossible, at least in my experience, because fundamentally the person is going to interpret every single thing you do as a pseudo love. So it's the same problem given to therapy, and the problem with therapy is that you meet the person regularly, right? So it becomes very, very hard to disentangle. I should also say that there is a natural way of healing these sins that's I wouldn't advise, but if the pseudo-lover object vanishes or dies, the person can start to grieve the relationship and move on. Or even sometimes the person might commit suicide, feeling that, well, now that the other's gone, they have to go as well. So it's a very nuanced conversation, but some erotomaniacs do tend to, should I say, heal when the death of the person occurs. And when I mean that, it's not they've killed them, right? It's like natural death, like disease or old age and so on and so forth. Also, very interesting specific situation. If ever, for some unknowable reason, the pseudo-lover starts to really fall in love with the erotomaniac and dates them, marries them, has children with them, it can stabilize the erotomaniac, meaning that the hopeful phase never ends and the person just like continues with the relationship becomes real and they're stabilized. So again, wouldn't recommend because the mental illness is still there, right? But it's very interesting to see that there can be those developments, especially because when I was studying the syndrome, when I was yet still a student in psychology, I always wondered what would happen if that was the case. And well, apparently, they can live a normal life. Interesting. It's a very interesting phenomenon. So, in this syndrome, there can also be a medical side to it. I know that some forms of medication like pimzoids, like second atypical psychotics can work, antipsychotics, for example, like pimzoids. But I don't know to which extent, as I'm not a psychiatrist, but I've heard that there can be some form of medication that might diminish a little the delusions without them being completely like pushed out by medication. So it's a very interesting syndrome, which is very rare, and often I should say, I think it's like 80% of cases are women. There are 20% of cases of men, but they're mostly women. And it's a form of paranoia, as it might not seem obvious, but what happens is that the person projects their love into the other, meaning that it's the other that loves them. They, quote-unquote, don't love them. It's the other that loves them, and they know it. So this is a form of paranoia. It's not, for example, hysteria, where the person's going to say, oh, I'm so special, they love me, and I would love them. It's more like, I know that the other one loves me. I know it. Even if there's no clear signs, I know. And it's something that's very common to paranoia. If someone tells you, I know, like convinced, completely bulletproof against any form of reasoning or any form of criticism, like they don't argue, they will just tell you, I know, you can be quite sure it's paranoia. And erotomania falls into that category of like, they know. And they are completely convinced of it. You can't like logic them out of erotomania. Now you have to accompany them and try and let the idealized part of their personalities and what they see in others, because often they see them as the perfect being. Trying to reduce that ideal might help them and support them in developing their own sense of self, but it's very subtle, and I don't want to make it seem like it's easy. It's a very difficult syndrome to work with as a clinician, but it's also a very difficult syndrome for the individual living it. As they become obsessed, they stop really doing anything else. Their minds are completely filled with the idea of that pseudo lover. Also, I should mention that there are two subtypes of erotomania. The first one is pure erotomania, meaning there's no additional mental disorders, there's just that one, which is pure paranoia and delusional thinking. The second one is a mixed, meaning it's erotomania, but there's other forms of disorders like schizophrenia, bipolar, personality disorders, and you name it. So very interestingly enough, those two forms don't have the same outcome. The mixed forms, the ones with other mental illnesses, have a much better prognosis in regards to erotomania. Pure erotomania, however, is very difficult, as the delusional syndromes do not subside easily or even at all. So I also want to add that the subsiding of symptoms is linked deeply with the person, their history, and their ability to be able to monitor, think about themselves and their introspection. So it's not like a recipe, but it's a very difficult syndrome to work with. And fundamentally, it's a very important one to know, as most people nowadays don't know about it, and I think that that's an oversight, as they might miss the signs early on, and they might think that it's a bit histrionic, or it's a little odd, but it's not deep mental illness, whereas it is a very severe mental illness that a clinician absolutely has to be able to, at least in my opinion, see the telltale signs of, because when you take it early, you might be able to avert the third phase, which is the hardest phase, and when they're in there, it becomes much more difficult to do anything, because even restraining orders, even prison, does not prevent the person from continuing, as it has been studied that erotomaniacs that leave prison just go back to stalking the other person or go back to harassing them. The same goes for measures to prevent any form of closeness. That doesn't work. The law does not work in terms of erotomania and its delusional content. So people are not going to stop because they're delusional. So there you go. That's also why it's complicated, because contrary to a lot of other mental illnesses where the law can have an impact, erotomania, it's not too great on it. And last thing I wanted to say is that even though it's in majority statistically a woman's mental health issue, men also have it. When men have it, it's even more complicated, because men can turn violent quicker and with actions that are much more severe. So here you go with that idea that like women have more of it, but men are more extreme when they have it. So that pretty much sums it up. I hope you like the explanation, and if you have any questions, please feel free to drop them by in the comments. I'll see you in the next one.